we can get started. Good evening, everyone, and welcome to the President's Speaker Series event. Tonight we have a very special program focusing on alumni who have careers in medicine, which is very exciting, as we are about to launch a nursing program this coming fall, our first foray into the clinical field. Tell us why you chose New England College as your college and what your plans were as a freshman.
So if I'm perfectly honest, and I'll try to be, I was a musician in high school. I was, studying as a musician, and I thought that's what I was going to do. And I stopped applying myself in high school toward the end. And when I spent a summer at Berklee College of Music between my junior and senior year, and it became clear that I was disillusioned at that point. It became clear I wasn't going to be the musician I thought I was going to be. A friend of the family had a son who went to New England College. His name was Joel Lindsley, and he had done well and enjoyed himself, and they recommended it, and I found myself here. It was no more or less than that. I majored in sociology and psychology, and I started working in a psychiatric hospital after college, and found myself much more drawn to the medical stuff that was happening there than the psychology, and with a couple of different fortunate contacts with people who'd become mentors, I found a path to medical school.
So I initially went to college in South Carolina. When I applied out of high school, I wanted to get out of New Hampshire, and I didn't want to go further north, both of which I have broken at this point. But so I kind of ran away. I applied to a handful of schools, and South Carolina gave me the biggest scholarship. And then I was just at a spot where coming closer to family made a lot of sense. So I moved back up here. I grew up near Keene State, and I was looking to transfer there. And they kind of told me, like, if you're interested in science or interested in the medical field, you probably shouldn't go here, to be quite frank. And I was like, oh. So I started looking at other places, and I found New England College and that they had kind of similar science degrees here. And it was kind of near where I needed to be living at the time, too.
And what was your major?
Health science.
Health science. Did you always know you wanted a career as a nurse or in clinical medicine? Tell us about that.
I did not. When I was in high school, I did meet with our school counselor, as most people do, in about 10th or 11th grade. Told him I wanted to be a veterinarian, and I was not encouraged at that point. He said that my grades weren't great and that, you can't really get into veterinarian school. It's very competitive. So why don't you go to vocational school? So I did. I went to vocational school to become a hairdresser, and then I did that for about 10 years. And through the labor delivery process, I had the most amazing nurse take care of me. And by the end of it, of the experience, I had a baby, but then I also had a career goal. I said, I want to do what you do. How do I do what you do? And the nurse said, you have to go to school. And so I had a vision, and I enrolled in school at Next.
That's wonderful. Have each of you had mentors in your careers that helped you really realize your vision?
Yeah. So that story, that's the greatest, and that's the way it happens, organically. I think most of the time is somebody just takes the moment to, spur you on and give you, allow you to imagine something that you hadn't given yourself permission to imagine.
Yep.
And so for me, when I was working in that hospital, there was this nurse named Mark Leary, and he was about 40 years old at the time. And, he could tell I was motivated to do something, and, a hard worker. And I was working some night shifts, and we would spend hours talking about evolution, everything. We both had an interest in this guy named Stephen Jay Gould, and read his books and talked about it and stuff. And he said, you should go to medical school. And, I hadn't really thought of it as it never occurred to me. It really hadn't occurred to me. You seem to have known early on. I didn't know early on. And I didn't know what would be required. And he said, you need to do research, you need to take pre-med classes, and started meeting other people and getting more advice. And I think if you're open to that kind of thing as a student, or a postgraduate person who's interested in learning, or pursuing something, I don't think it has to be medicine or anything, even medical. I think people enjoy being mentors. I enjoy it now. I get an enormous amount of pleasure from it now. And you'd be surprised if you, as a student, reach out to somebody, and decide you want to paint portraits, they'll mentor you.
And I think it shifts at different parts. So when I first came here, I came from a school with not a very good science program, and the science program here is excellent if you guys haven't found that out yet. So I was kind of just covering my bases. I knew I was interested in the medical field, but didn't know what I wanted to do, so I kind of stumbled into the right major. But so I was taking my classes, and at this point just trying to cover bases for like multiple different graduate programs, and I wasn't actually sure if I could go to graduate school. And at some point I was taking all these labs and stuff, and Lori sent me an email at some point, I think, mentioning the summer research and asking me if I thought about applying. And I hadn't. I heard other people talking about it, but it felt kind of too far-fetched for me to do. But the invite got put out there, so I applied, and I looked into the other programs and really just applied for her program, and I ended up doing that. So, and throughout that summer and the rest of the semester I was there, she kind of poked and prompted, asking about graduate school and what I'd do next, and really just kind of shared how she did it, and that because there were moments in her career path that she didn't think she could do it. So it kind of helped me realize that I could do this. This is something that a normal person like me could obtain.
There's a lot of time when you're in the OR doing things, talking about other stuff. And I try to break the ice in the OR, and I make the new person do karaoke, but I also, if there's any sense of this person being interested in anything else, I'm always, I'm pushing and prodding.
And Angie, was there a person in your life, obviously that nurse when you were having a baby, but did somebody help you along the way, give you guidance?
Well, if you think about nursing, in the first year, research shows it's one of the hardest transitions for the nurse to make, is that first year going from being a student to being in independent practice. And there was, in my very first job, I was there for a year, and I wanted to quit. The team, I just didn't feel like I fit. Maybe I made the wrong decision. But then I decided to give myself another chance, and I decided to go work in a different hospital, in a different department. And I was so fortunate to be able to work with, there were 10 of us in post-anesthesia care. And it's a tight-knit group. We worked really hard together, but I learned so much during that time. So I can't really pinpoint one mentor, but I can say that I had a team that really supported me.
Tell us about your areas of practice and what made you choose those areas.
I happened into urology with about as much lack of purpose as I happened into medical school in the first place. When you find yourself, I know there's been a transition in medical school education to go, the traditional model is 2 years of labs and classwork, and then 2 years of clinical work. And so it's really, you're in medical school for 2 years before you really see your first patient. There's been a push to change that, and I don't know, I'm sure by the time you're in medical school, you're doing clinical stuff.
They kind of stick you in first and second year a little bit.
Yeah. Well, so third year we started doing what were called rotations, where you'd spend a month or 2 months on a service. And when I did my general surgery rotation, one of the subspecialties was urology. And I like probably most people here, unless you have a urologist, you really don't know what a urologist, there's no reason to know what a urologist does. But when I went on this rotation, these guys were the smartest residents. They seemed to run the hospital. They were funny. They were happy. They worked hard, and they did everything. They removed kidneys for cancer. took bladders out for cancer and made new bladders out of intestine, and treated kidney stones, and it seemed like you could craft an entire career out of any one of the tiny little things that they did. So for me, it was just obvious, And the chairman was a big shot, and he'd put his arm around you and just say, "Hey, come have a look at these films." He was like the ultimate mentor.
Wow.
He could just look at you and cause you to go into urology.
Alexa, how about you?
So I kind of went into medical school with a little bit more experience with surgery and anesthesia, since that's where I'd worked for years. And I didn't have as much interest in anesthesia because I didn't like how they only know patients for a little bit. So I was kind of thinking about surgery, but you have to rotate through every different specialty anyways. And I liked pretty much all of them. Like every rotation, I was like, yeah, this is awesome. Like I could do this. So it makes it really hard when you get to the end of your third year and you're trying to plan out your fourth year and figure out what you want to apply to. And at this point, I really knew I liked surgery going into medical school. I loved it during my third year, so I was heading that way. I had kind of been like a little bit setting myself up for that since the start of medical school. And then I rotated in the emergency department in August or September of my fourth year, which is about a month before your residency applications are due. So it's not terribly advised to change your entire application at that point. But I pretty quickly realized, just seeing the doctors work with patients, that I could see myself being this type of doctor. They were very down to earth. The way they work with the nurses and techs, they all work really closely together, which you don't get in every specialty. And then just the patient population I really like. So I kind of swapped everything around late in the year and applied to that, and I still love it. Obviously haven't been doing it for super long yet, but it's challenging and it changes a lot, and both of those were appealing to me.
I'm not a medical person, but it must be a degree of unpredictability to it, and you have to be able to respond to that.
It's exciting.
And I think that's what pulls some of us in, and somebody walks in and you have to just start from scratch and figure out what's going on with them. And sometimes it's like the nurse is rolling them into the room and they're like, "We need a provider in here," which your first few days you're like looking around and you're like, "Oh, that's me, I'm the provider." But yeah, that's part of the fun of it.
And Angie, I know you ultimately chose education, but you have experience in other areas. Did you enjoy one more than another?
Well, I can tell you that nursing is like medical school, where you have to rotate through all of the services, and then you can choose when you graduate what specialty you want to specialize in. And my mentor, the person that nursed in labor and delivery, I thought I wanted to be a labor and delivery nurse until I did it. And I realized, no, I don't want to do this. I hate this. No, did I make the wrong decision? And then what I found that really clicked with me was cardiac. Some people have a hard time with it. Some people, pick it up right away. I just picked it up and I loved it. And I then wanted to specialize in critical care as a critical care nurse, and so I worked in that critical care unit for a year, and then realized it really wasn't for me. Went to post-anesthesia care, and then there's a certain, maybe it's my personality, but once you do something and it becomes predictable, like you said, the ED, it's very unpredictable. PACU became very predictable. I felt like a retired racehorse. I was ready to then move on. It's time to, challenge myself. So then I went to the emergency department to challenge myself. And then I could really, after 7 years, anticipate, depending on which provider was working, I could anticipate what kind of night I was going to have. So then I was ready to move on, And then if you work in a smaller organization, you tend to see the same patients over and over and over and over and over again as primary care. So I was ready to challenge myself again. So, and then the education piece of it is that everywhere that I did work, I was a preceptor, and I loved working with new nurses or new employees to help them acclimate and become part of the culture.